Hi, my name is Carla Cortez. I'm a licensed marriage and family therapist. I will be helping Emily Cortez today with her assignment.
All right, the first question is, do you feel there's a stigma to having anxiety or getting help?
Yes, I do believe that it has a stigma. I think that the stigma comes from years before, but not only anxiety, overall mental health does have a stigma.
Good. The next question, does culture make a difference of looking at anxiety as something less than mental health, or do they play it down?
Absolutely. Culture has a huge part in it. Um, some cultures look at it, downplay it because it's looked at as a negative, as if it's not something that is real. First of all, it's looked at like it's just your nerves, or it's just a lot going on, feeling overwhelmed, when anxiety is actually more than just feeling overwhelmed.
Right.
I think they play it down to say, oh,
Just get over it, relax.
right, get over it. And it's not they downplay it to just say, you suck it up type of thing,
Right.
and you'll be fine.
Okay. How do you know if a patient needs medication for anxiety?
Well, it depends on the duration and severity, depending on the impairments that it's causing in their life as well. But the two biggest factors are the amount of time they've been dealing and struggling with it, and of course the severity of the symptoms as well.
Okay. Why should people seek help for their anxiety? What are the dangers to it being treated? Many people do not get treated and overcome it. So the first part of that question, why should people seek help for anxiety?
So they can learn some skills and tools to reduce the impact that it's having on them, or in fact, there's ways to lessen the symptoms on a daily, or however the severity is, to lessen them. I think most people have different levels of anxiety too, and the effects can and the impairments can be very different as well.
Mm-hmm. What are the dangers to it being untreated?
The dangers can be, well, definitely that they become more severe, and the impairments that it causes on a person's day-to-day life. We have different facets in our life, whether it be school, work, family, relationships, whatnot. But when it starts to impair those areas, then you know that they can increase one area to another. And so it's important to find ways to say, hey, let me get some help and see where I can, find a balance in all of it.
Mm-hmm. So when people do not get treated and they overcome their anxiety, why does that happen? Why do some people need the treatment, and why can some just overcome on their own?
Well, I think that most people can learn to regulate their emotions, and others have a little bit more of a struggle. You'll hear a lot of therapists or psychologists talk about coping skills, and some people can do those and learn those on their own and do pretty well, and they can control or lessen the symptoms with those.
Okay. Has the amount of patients increased since the pandemic has started?
Exponentially, yes.
Is it patients with anxiety, or just patients just in general?
Well, in general, there's a lot of the numbers have increased definitely, but a lot of it the majority is a lot to do with anxiety, depression, or a combination of both. But anxiety has been one of the highest numbers to come across, yes.
Okay. How do you help college students, or any students with anxiety in the classroom? What are some tools to help them?
Again, we're going to go back to talk about those coping skills that we were talking about earlier, and it would be teaching them some certain skills to see what would help. There's meditation, there's mindfulness, there's also things that you can do before or after class, like exercise, or maybe a breathing exercise, or you can sit in the classroom and no one will know if you close your eyes for a couple of seconds and think of a certain skill that has been taught to you. It just depends on the person. Everybody's different, so what works for one doesn't work for everybody, but it's just a matter of finding and gaining, and just, we call it a toolbox. Just fill it up with different ones and see what works for you.
All right. Do you see a difference of anxiety in girls and boys? Does one have more, or are there different symptoms?
It's the symptoms are pretty much the same, but I personally have seen it to be higher in girls or females. Yes, I think that maybe the stigma being that they're males, they don't want to say, or culture has a lot to do with it as well. But maybe what I've seen is that females tend to be a little bit more trusting and open and wanting to reach out for help. But they do both have anxiety, but I have seen it to go up and increase in females.
Hang on, I'll just edit this out. Is the lighting good still? Okay. Well, you kind of said this earlier, but can anxiety lead to depression or another disorder?
Absolutely. I think that when it impairs certain parts of your area of life, it can not only lead to depression, but there's other things that, like panic attacks, or even a combination of all three. It just depends on the individual and if they're getting help or not. So yes, I do believe that.
In your experience, how do you see anxiety affecting these students socially?
Well, number one thing we've seen is they withdraw and they isolate, feeling that that's what gives them some balance and maybe some peace, because that's what they can control. I think that it's important to remember that every individual is different, but the number one culprit that I think that I see for those who are young and with anxiety, they tend to withdraw and isolate themselves and feel hopefully that they can do it on their own and try to find maybe some coping skills on their own in that way. We have found that even when that happens, so that their anxiety still tends to be present or increase. And so, I'm glad that when our patients do show up, that we can, start from there and work our way up.
Last question. So there's different severities to anxiety. What are they though? Like in mild, for example, like what are those symptoms? You can only do like mild and severe if you want. I would like to see the difference. Why is one mild? Why is one severe? What's the difference?
Right. Well, again, the individual is different, and so the symptoms will be different. However, mild will be, can't stop thinking about something, it stays on your mind, or you start having trouble with some sleep, or even your appetite. And the severity is when it starts to go into other disorders like panic attacks, and those are really real. People can't have, they start having a panic attack, which involves, heavy breathing and, their heart beating and sweating and shaking. And there's a difference of severity in those two. You can have a couple of, some thoughts that, I can't stop thinking. And, have you ever heard of something being called, racing thoughts? You can't stop thinking. You keep going, and it causes you to not be able to sleep, for example.
Yeah.
And those are mild because eventually, you'll fall asleep, and then the next day is a new day. However, those are severe. Those increase, and then of course it goes into other things, like we said, like panic attacks or even depression.
Well, those are all my questions. Thank you for sharing, and thank you for your time.
Thank you. It was a pleasure.
According to the article, Effects of COVID-19 on College Students' Mental Health in the United States Interview Survey Study, the results of this study, of the 195 students, so approximately 71%, indicated increased stress and anxiety to the COVID-19 outbreak. Multiple stressors were identified that contributed to the increased levels of stress, anxiety, and depressive thoughts among students. Some of the stressors included fear and worry about their health and their loved ones, difficulty in concentrating, disruptions to sleeping patterns, decreased social interactions due to physical social distancing, and increased concern on academic performance. According to the article, Effects of COVID-19 on College Students' Mental Health in the United States Interview Survey Study, the results portion of this article stated that out of the 195 participants, 71% indicated that their stress and anxiety had increased to the pandemic, whereas 20% remained the same. Additionally, only 5% use mental health counseling services. According to the article, Adolescent Academic Worries Amid COVID-19 and Perspectives on Pandemic-Related Changes in Teacher and Peer Relations, this survey was about the perspectives on pandemic-related changes in teacher and peer relationships and how that was affecting the students. According to this article, it states overall worries related to academic motivation, for example, not being able to motivate yourself to do schoolwork, were reported to be the most frequent due to stress and anxiety.